Hello, everyone, and welcome to this special edition of MacroPro's Coffee Breaks. For those of you who don't know MacroPro, we are a document retrieval company that can get you records nationally. Well, in fact, we can get you records internationally as well. We do these coffee breaks from time to time to complement our MCLE and CEU credits that we provide through our educational department. My name is Diane Cohen, and I'm Vice President Client Relations, and I head up that department. Today, I am with Kirk Adamy, one of my colleagues. Kirk, how are you, and how are you dealing with the second stay order?
Hey, Diane, I'm doing well. It's hard not seeing my friends and family. It's easy to eat everything within 6 feet. But honestly, as an introvert, it hasn't been as hard for me as it is for some of my friends who are true extroverts.
So coping with COVID-19 is very difficult, but today we have a speaker that's going to talk to us about using real life coping skills, things that we can do, help us identify our emotions and how to deal with them. I can't wait to speak with Dr. Mirkof. Can you tell me how you found Dr. Mirkof to join us with our program today?
You bet. Like so many of us right now, we have time to log on and watch webinars and presentations. I had the chance to log in and hear Dr. Mirkof speak on this topic, and it just resonated with me. Such good words, such practical suggestions, and I thought more people need to hear his message.
I see that Doctor just joined us. Welcome, Doctor. We are really excited to hear about what you have to provide to us today. There are so many of us that are struggling. Can you tell us a little bit about your background and what we're going to be learning today?
So my name is Dr. Mirkof. I am a psychologist. I primarily worked for the county and city of Los Angeles. For the county, I worked for the LAPD's mental evaluation unit, where I would respond to psychiatric emergencies in the field with a police officer. And I currently work for the city of Los Angeles, where I perform pre-employment evaluations for candidates seeking employment with LAPD as a police officer, and also for candidates that are seeking employment in other safety sensitive positions within the city, like firefighters and detention officers. So thank you guys for having me. I'm going to talk a little bit about coping with COVID. I will start with discussing the relationship between our feelings and our thoughts, and then how to cope with some of those feelings. And then I will also go over some questions and answers that have been brought up before in presentations I've given like this. And then I'll also go over some resources that I think might be helpful for everyone. So it's not a surprise that past pandemics and this current one are associated with high levels of anxiety. We're dealing with an unfamiliar health threat, and if we get sick, we can manifest symptoms that are similar to a flu or a cold, or even be asymptomatic and then possibly spread it to our loved ones. And on top of this, our routines have completely changed with constant hand washing, social distancing, quarantining, and not to mention all of the economic adjustments we've had to make. You know, either being furloughed or laid off, or keeping our jobs and having to deal with how to manage working from home, and the work-family balance has been tough. But with that said, I do want to say that anxiety is meant to be helpful. It's the body's threat response, so it helps us get prepared, and that's why and how we can get deadlines in, or how we can respond appropriately and in a timely fashion to emergencies that we deal with every day. And as it relates to COVID, it's what helps us take precaution, like wearing masks and social distancing. Now, for some, based on their risk level, I'm sure there are more precautions that they would need to take, but after we've all taken the necessary precautions, our anxiety should start to dial down, because we don't have control over the rest. We've done everything that we can, but for some, it doesn't. And let's talk about why that might be. So one reason is that thoughts affect the way we feel. So much of the goal in cognitive behavioral therapy is understanding that concept, that our thoughts do influence our mood, our feelings, our emotions. And if we're thinking irrationally, then we may feel irrationally. So an example of this is a deterministic, all or nothing, or catastrophizing type of thinking. So thoughts like I won't, or I can't make it through this, or if I get it, I'm gonna die. And some of us don't even know that we're thinking this way. So the goal here is to really take some time and pay attention to our thoughts, and then try and challenge our thoughts if they are irrational. Um, so if we are thinking I can't or make it through this, we have to ask ourselves, using fact-based reasoning, what evidence do I have to support this? I've made it this far. This is what I've done. Um, is there any evidence that I won't make it through this? Or if I get it, I'm going to die. Again, we have to ask ourselves, what evidence do I have to support this? Is it possible? Yeah, anything is possible, but is it probable? And that's what we really need to focus on. Reframe the thought of, if I get it, I'm going to die, to if I get it, I probably won't die. Or to reframe the thought into something more rational, more logical. Another thing that can be helpful in this is avoid reading headlines. Headlines, we're bombarded every day with fear-inducing headlines that are made that way for a reason. They want to draw us in, and they want us to open up the article, but we have to remember to stick to good facts and reliable and credible sources of data like the CDC and the WHO. Another thing that I think is helpful as well is to make an effort to find the positives in everything that's going on, to challenge yourself to find the opportunities. Are there hobbies or interests that you may have gotten involved in that you didn't have time to do before? And to not focus so much on the negative. Sometimes we're so wrapped up in the negative that it takes away from the positive. A great example is, we can go through a day of being praised at work, and you turned in great work, this and that, and one slight criticism, we could spend the entire night thinking about that criticism without reminding ourselves that we had so much more positive. And I think this all ties back to concentrate on the way that you're thinking about things, and then challenge those thoughts and reframe those thoughts into something that's more logical, reasonable, and fact-based. Let's say we're trying this, but we're just in a situation where we can't, we're just stuck in thought, and we're doing everything we can, but we just can't get out of it, and we're dwelling on something. What are some helpful things that we could do? Mindfulness techniques are very helpful because they bring us to the current moment, the only thing that we can really control, and take us away from worrying about the future or thinking too much about the past. So a good technique, my personal favorite, is the 5 senses. So what I'll do sometimes when I feel like I'm just kind of lost in thought is try and bring myself back to the present moment by going through each of my senses and trying to notice something with each sense. So for example, I'll start with sight, and let's say I'm in my office. I'll just kind of look around and try and notice something maybe that I haven't noticed before. I'll move on to hearing and think, how many different sounds can I hear right now, and what type of sound is that? To touch and feeling, and what does it feel like sitting in this chair right now? What does it feel like with my arms on the armrest and my back pressed against the chair? And this is helpful because, again, it brings us back to the current moment. Another technique very similar is to concentrate on 3 things. You pick 1 or 3 senses, and then you try and identify 3 things by each of those senses. Another helpful technique is to use a breathing technique. Slow breathing triggers our body's rest and digest reaction and helps turn down our anxious flight or fight response. In the same way that when we're anxious or panicked, we will take short, quick breaths. When we're relaxed, we take long, deep breaths. And so because we can control this, we can do a technique called box breathing. So box breathing is simply breathing in for 4 or more seconds through the nose, holding that breath for 4 seconds, releasing it for 4 seconds, holding the release for 4 seconds, and to repeat that over 4 or more times. Other good coping skills are to stay connected. Although we have to physically distance, that doesn't mean that we have to necessarily isolate. And there's a lot of useful tools now, Zoom and FaceTime, where we can continue to stay connected with our friends and family. Exercise and sleep, of course, are huge, and exercise especially is good because it releases feel-good hormones. For me, when I work out in the morning, I feel accomplished throughout the rest of the day, no matter what happens through the day. So exercise is very helpful. I think I got out of presentation mode. And again, back to what I was saying about trying to think of the opportunities in the negative. You know, picking up a hobby that you've always wanted to do that you never had time to do before but may now have time for, or doing an online course. So personally, I got kind of into biking. My dad had an old bike in the garage that he wasn't using. I grabbed the bike. I've been going maybe 2 or 3 times a week since all the gyms are closed. I've been trying to do at-home workouts, and for online course, I'd always wanted to learn how to play the piano. I bought a $100 keyboard from Amazon, and I've been watching free YouTube video tutorials on how to play. So doing things that, finding opportunities in a negative time can be very helpful. Maintaining your emotional and mental well-being. So I'll go over some commonly asked questions that I've had in the past. One is, I'm at work, I have coworkers who aren't following the recommended safety guidelines. You know, what should I do? A gentle nudge versus lashing out. So lashing out, although everyone's emotions are high, is not helpful. Some people, yes, intentionally, maybe not following the safety guidelines, but some forget, you know, and I've fell victim to that too, leaving my office and going to the bathroom, forgetting to wear a mask, and without really knowing, but I may be making someone I walk past feel uncomfortable. So a gentle nudge is helpful. And of course, if that gentle nudge doesn't work, it could be helpful to talk to a supervisor. Some agencies within the city, I won't name them, but some agencies will discipline if there's an employee that continues to not follow the recommended safety guidelines. Another question is, my family routine is wrecked and we've all been cooped up together for way too long, and I can totally relate to this. Something that's been helpful, and especially helpful for me, is trying to keep my routine as much as possible. So I do my best when I wake up to kind of stick to a routine I would when I'm working from home, as if I were at work. So I'll go to a space that I know I won't be bothered. I will get out of my pajamas and maybe not wear something I wear at work, but definitely I'll dress up a bit just to try and keep my routine as much as possible. Another good way, and this kind of goes with maintaining some of your social relationships, is to reach out to friends and family for advice and see what they've done, especially those with kids now that have to stay at home. And it could be also a nice excuse to kind of reach out to someone that you haven't spoken to in a while, offer some support, and then, you know, ask and talk about what they've done that's worked and what you've done that's worked and hasn't, and kind of feed off each other for ideas on what's worked. Now, feeling tired and irritable, feeling burnt out. I've listed some of the symptoms of feeling burnt out, and I think we all get there. Again, it's important. Try and keep your routine as much as possible. Taking small breaks is pretty helpful. It is for me. My office doesn't have any windows, so sometimes when I'm just feeling overwhelmed, I'll go outside and do a little mindfulness technique and kind of notice things outside to get my mind to the current moment. Home workouts are also helpful. Of course, exercise, releasing those feel-good kind of hormones. Maintaining social events through Zoom, through FaceTime. I know some organizations will do like weekly or monthly happy hour with coworkers to try and stay connected, especially those that are strictly working from home. And then not forgetting to avoid patterns that might negatively affect your well-being. So too much social media use, getting bombarded with those fear-inducing headlines without really parsing how credible the information is, can really hurt someone's well-being. Eating too much junk food or resorting to alcohol or excessive shopping, all things that you may want to stay away from. Now, what if I'm doing all these things, I'm doing my best, and nothing is helping? So the question is, like, when should I reach out for help? the rule of thumb generally is if it's been a week or more, 1 to 2 weeks or more, and you just feel like you've done everything you can and it's not getting better, you just are continuously feeling irritable, exhausted, and unwell, it might be a good time to reach for help. Also, if you've been resorting to excess alcohol or drug use to kind of cope with the times, it might be a good idea to reach out as well. Now, how can I reach out? So a start for those with, let's say, private insurance, a start can be to calling the insurance company and finding mental health providers in your area that you can call and see what their rates are. A lot of mental health providers right now with the current times are waiving copays, and most mental health providers are also doing counseling sessions through Zoom or other kind of telehealth portals. So that could be a start. And here is some other resources for those in Los Angeles County. The Los Angeles County has a 24/7 helpline. The number is right there on the screen. And this is pretty much the gatekeepers to mental health within the county. So they can do everything from provide mental health referrals to those with government insurance like Medi-Cal or Medicare, or even those with no insurance at all. They can, if there is a psychiatric emergency if one of your loved ones are going through a psychiatric emergency and you feel like you don't want police involvement, of course, if it's urgent, I would say call 911. There are mental evaluation units. A lot of police officers have adopted this mental evaluation unit model. But if you feel like it would be more appropriate to just have mental health clinicians respond to help you or a loved one with a mental health crisis, they will dispatch a mental health team that can come and give you on the spot referrals, help, and if it's needed, if it's if a situation where an individual might be a danger to themselves or others, can help facilitate a mental health hospital transfer. So all that is available. I also put up the Department of Mental Health how to get help. So this will also they have a really great walkthrough on based on insurance, based on need, how you can get help and where, and based on income or based on financial limitations, how you can get help. They're also offering a meditation app very similar to mindfulness, just helps you come into the present moment and not associate so much with your thoughts, but to just kind of watch them come and go, but staying in the current moment. The meditation app, Headspace, they're offering it for free. I think all it requires is that your location services will show that you're within LA County. You can download it for free. All of that is in the lacounty.gov website. Other good reliable sources of data, of course, the CDCR and the American Psychological Association on the bottom have really great tips, articles, even videos on how to cope with COVID, and ranging from anything to individually, how can I kind of get through this time, all the way to, how do I talk to my kids about what's going on, and how can I kind of manage my work-life balance by working from home and my kids are now at home. And then NAMI also has some really great resources. NAMI is the National Alliance of Mental Illness. NAMI is also great for individuals who may have a family friend or loved one who has a mental illness and needs support as a friend or family of that person, maybe support in understanding what that person is going through and how to help that person. So these are all some really great resources that are available.
Doctor, I have a question for you,
Yes.
if you would indulge me one. First of all, I'd like to mention to everybody that there is no stigma for getting mental health. The most important thing is that people need to do that. And I find that we live in a day and time that we're very fortunate because there are no stigmas any longer. What would you say is the number one thing that we need to look out for our loved ones as a sign that there's something that's not right with them and that we need to reach out to assist them?
I think any change in kind of their baseline behavior could be a trigger. So if they're generally kind of this bubbly person and all of a sudden you sense something off, it never hurts to ask. And I think a lot of people are uncomfortable when someone kind of reveals some information to them because they feel like they have to offer a solution. But really, being supportive to someone is just listening to them and validating how they feel. Most people don't want, and even with, when I said like call insurance companies, some people may just feel so overwhelmed that they don't even want to go through the time to call and try and help find resources. So maybe asking like, hey, do you want me to help you find some resources? Do you want me to help you find, I can get like a list of providers try and find a list of providers in your area that offer mental health, maybe those without copay, and maybe help facilitate it in that way. But ultimately, being supportive is listening and validating. And I think anything outside of someone's normal character can be a sign that maybe there's something up that I need to ask a little bit more about.
Well, thank you so much, Doctor. Truly appreciate your time today. And Kurt, I really appreciate you finding Doctor for us. And we will see you at the next coffee break in a few months, hopefully. Bye-bye.
Thank you, Dan. Thank you, Kurt. I hope everyone found it helpful. Thanks again.